GPs are being urged to find out more about the early symptoms of Lyme disease. Public Health England figures show the South West has one of the highest rates of the bacterial infection caused by ticks, but some patients still aren't getting the help they need when visiting the doctor, as Duncan Slightholme reports.
Making the most of the outdoors is important to Fiona Elwood and her family. Their home near Dorchester is in an area with one of the highest incidences of Lyme disease in the country. But when 2-year-old Emily showed symptoms, including a distinctive rash earlier this year, their GP was cautious with prescribing antibiotics.
She'd been bitten by a tick. She had the bullseye rash. She'd been unwell. She wasn't eating. Even my husband said she looked really frail. I was so anxious, and she'd come back with a positive test, and I was still being told she probably doesn't have Lyme's. And for me, it wasn't that she had a sore throat and, we were asking for antibiotics. This was Lyme's disease.
Lyme disease is caused by bacteria that are spread by ticks. In around 2/3 of cases, a distinctive bullseye rash appears within a few weeks. Other early symptoms can be similar to flu, with fatigue, fever and headaches. Doctors say treating Lyme disease quickly with antibiotics is very effective. But if it's untreated, patients can go on to suffer for years from things like fatigue, muscle pain and problems with their heart and nervous system. In July, guidance to GPs was changed, encouraging them to prescribe a 3-week course of antibiotics to patients with the characteristic bullseye rash. But that doesn't always appear, and patients may not realise they've been bitten by a tick. Dr. Sandra Pearson from Torbay works for a charity that advises GPs on Lyme disease.
We as a charity do hear reports of people being offered just short courses of antibiotics below what NICE guidelines recommend, or maybe the dose is wrong. That can be an issue with children. And so, there is evidence out there that things really need to improve.
During filming, we spotted a tick. The advice is to be aware of these little creatures, the places they live, and the illnesses they could cause.
Duncan Slightholme reporting.